We are very happy now to shift into our panel presentation and discussion portion of this meeting. And this will be focused on some excellent work coming out of the A.J. Drexel Autism Institute, Advancing the Understanding of Life Course Outcomes, the Autism Transition Research Project. The presenters here will be Lindsay Shea, Anne Rue, Jessica Rast, and Elizabeth McGee-Hasrick. And the respondent will be Juliana Rava, who is a PhD student and AIR-P graduate researcher at UCLA Health, the Fielding School of Public Health. I'm very happy to invite all of you for this discussion and presentation.
Thank you, Dawn. We appreciate it. Welcome everyone to the presentation today, focused on our work to advance the understanding of life course outcomes. We embark on this work through the Autism Transitions Research Project, or as we affectionately call it, ATRP, which is funded by HRSA. I want to take a minute to underscore Dr. Kuo's acknowledgement of HRSA's collaborative partners in this work. We're grateful for that partnership and work together. I'm joined today by my colleagues on the ATRP team, Dr. Elizabeth Hasrick, Jessica Rast, and Anne Rue. And I am Lindsay Shea. I lead ATRP out of the A.J. Drexel Autism Institute, where it's based at the Policy and Analytics Center in collaboration with the Life Course Outcomes Research Program. And I lead ATRP in collaboration also with my colleague, Dr. Paul Shattuck, who is based at Mathematica. Next slide. Thank you. So for ATRP, we utilize a framework of 3 collaborative endeavors to advance our understanding of life course outcomes. They include the use of large national data sets, including surveys and administrative databases, to produce research and publications, including the National Autism Indicators Reports, or as we like to call them, the NAIRs. Today, Jessica Rast will be presenting on our most recent NAIR focused on mental health. We also have an initiative focused on social networks that will be presented by Dr. Hasrick. And Anne Rue is leading a study focused on the navigation of transitions called Transition Odyssey, which she'll tell you about more today. Our goals for this work collectively are to generate findings that have utility in improving transitions and life course outcomes. We look to inform how services are delivered and which services are prioritized at the population level, meaning that we seek to understand outcomes across populations and generate findings to inform population level policy as well. We seek to unpack why transitions go poorly or why they go well in order to build toward ways to replicate success and hone in on opportunities for improvement. Next slide. With that, I'll hand off to Jessica Rast.
Thanks, Lindsay. So I'm going to talk to you today about our most recent National Autism Indicators report on mental health and mental health care. So this report was a follow-up to one of our previous that came out last year, where we focused on health and healthcare. And in that report, we found that autistic children had high rates of many mental health conditions compared to some of their peers, and also that they had high rates of mental health service use and, importantly, unmet need for further mental health care. And then in our realization that this is a very integral part for healthcare and well-being overall. Next slide, please. So the higher rates of mental health conditions in autistic people likely have both genetic and social origins. We know that parents of autistic people have higher rates of anxiety and depression than their peers. But we also know that experiences of adversity and isolation and stigma may place autistic people at increased risk for mental health concerns. Specific things like camouflaging and heightened intolerance of uncertainty have been associated with increased depression and anxiety in autistic adults. And increasingly, clinicians and researchers are noting that stigma and lack of understanding, accommodations, and access to appropriate services are contributing to these mental health difficulties. So we know that we identify this as a very real concern, but also note that supporting mental health requires accessible and appropriate mental health care. Primary providers in the U.S. play an important role in identifying and accessing mental health care and mental health care needs. but they often don't have expertise in providing mental health care directly. However, mental health care providers often feel inadequately addressed to care or inadequately prepared to care for their autistic patients. They often might lack understanding of autism and how autistic people experience and communicate about mental health issues. And then they may also have some of their own biased assumptions that autistic people can't make meaningful progress towards improving their mental health. And this is a problem that's even worse in some groups where we know that there's additional experiences, especially in Black and Latino autistic people, where there are additional barriers to care, inappropriate care, misdiagnosis of concerns, and additional barriers to good mental health. Next slide, please. So I'm going to give a brief overview of some of our results from this report, and hopefully after I'm done, I'll put the link for the report if you'd like to go and read more. Next slide, please. So the most common co-occurring mental health conditions in autistic children were behavior and conduct problems, ADHD, and anxiety. And these things did vary by race and ethnicity in autistic children, which is what I'm pointing out on this graph here. I'd like to point out two specific things. So first is anxiety, the green arrow on the top left. So we know that half of parents of white autistic children reported that their child had anxiety, compared to about a third of children of another race or ethnicity. And then the next thing I want to point out on the slide is the relatively low rate of having any of these conditions in Hispanic children. So about 2/3 of Hispanic children had one of these conditions or more, compared to 3/4 or more of children of another ethnicity. Next slide, please. Okay, so management of mental health concerns and conditions is very important for health, for quality of life and safety, and for really all aspects of life. So we know that when mental health is not adequately addressed and concerns are not being met, behaviors can escalate to crisis. And without support, treatable mental health conditions can become more severe and disabling over time. Next slide, please. So nearly half of autistic children received some sort of mental health care, treatment, or counseling in the past year, which was compared to about a third of other children with special health care needs. This was more common in older autistic children, so those ages 12 to 17, compared to the younger ones, age 3 to 11, but still about 40% of those younger children had some sort of mental health care. But what I'm pointing out on this slide is that more than half of parents reported that it was difficult to receive mental health care. And this is more than parents of children with another special health care need, where about 54% had no difficulty, and even more parents of children with no special health care needs had difficulty. Next slide, please. Okay, so we found that mental health conditions were common in autistic people, and we know too that the use of psychotropic medication can be a very important component of mental health care and in the management of these conditions, and ideally prescribed as part of a holistic treatment plan that includes psychosocial approaches as well. Next slide, please. So we did find that psychotropic medication use was common in autistic children. Overall, a third of younger children, so those ages 3 to 11, and half of older children, ages 12 to 17, took some sort of psychotropic medication in the past year. We examined medication use by co-occurring condition, and so we found that the most common medication use was the most common in children who also had depression. So almost 80% of children with depression and autism took some sort of psychotropic medication in the past year. Children who had no mental health condition, autistic children, only about 6% took medication. We also were able to look at medication use in adults using Kaiser Permanente Northern California medical records from previously published research, and more of those findings are included in the report. And then we were also able to use another source for adults. We looked at some Medicaid records as well. So all that's included in there to have some more explanation about adult findings. Next slide, please. So our main conclusions were that the need for mental health services and supports is pretty critical in autistic people. And in order to address these needs at the population level, we will likely require some changes to policy that are impacting access, provider training, and other resources for autistic people. Next slide, please. So I'll briefly highlight some of our overall recommendations. So care needs to be more equitable for all autistic people. So we know that there is poor care and poor access to care in racialized communities. We also know that evidence-based practices in general for mental health are largely based on populations that do not include autistic people in the research. So this is a gap in mental health care for autistic people. Address problems of location. So I briefly mentioned the primary care versus mental health specialty care. We talk a little bit more about how we can bring these systems together to provide the best care, the most holistic care for autistic people. This leads well into improving systems of care. We know that many of these are fragmented and they don't talk to each other, and it's hard to get information from one siloed system to the next. So we need to integrate all these systems to provide more holistic and better care. And then finally, some provider training around autism and around mental health that could improve mental health care for many populations, not just autistic patients, but a lot of specific provider training opportunities that we discuss in more detail. And that is it. I will go to the next slide, please. I think I'll pass on to Elizabeth McGee-Hasrick now.
Thank you, Jess. I don't know, I can't see myself yet on the thing, but I'm hoping you guys, there I am. Thank you very much for this opportunity to share research about informal network supports of autistic youth experiencing transition. Next slide. Here's the team of us who are involved in this work in developing a new kind of network measure, which we call the multicentric network measure for autistic young adults in extended high school. Next slide. Our work targets capacity building efforts and collaborative community problem solving work to support autistic youth during these difficult transitions to adulthood. Next slide. We are measuring informal supports using a rigorous approach, which we characterize as social network analysis to capture heterogeneity, personal strengths and gaps, ecosystem capacities, and really looking at people and resources. Another advantage of social network approaches is the capacity to scale complex interactional dynamics more effectively. Next slide. And we're going to be presenting each of these different components to you today. Next slide. A little bit of background on the research I'm going to be sharing with you. We're really trying to understand these services cliff, but not just the services, but the informal support. So this, what we're coming to call this social capital cliff. So you don't just lose services when you leave high school, but you also lose a lot of connections and resources that you gained through your informal support networks. And in particular, we're looking at autistic youth in extended high school and how they experience transition. Next slide. We call the resources embedded in our networks social capital. And there are many different types of social capital that are present in our networks that can help us to have a successful transition. Some are more affective, like friendship, inspiration, respect, emotional support. Others are more instrumental, actual access to work opportunities, accountability, mentorship, some of those more direct, more instrumental and strategic supports that can help us to have a successful transition. And that's what we're using the network measures to capture. Next slide. We used a qual-quant approach in our study. Go ahead, next slide. Our first aim was to adapt a measure of social capital using qualitative research and cognitive interviewing. And then we pilot tested the measure, and that's what we're going to be sharing with you today. Next slide. For this pilot test, we enrolled transition age youth who were in extended high school right before their transition and then right after their transition. We did recruit 5 transition age youth who had applied for vocational rehabilitation funding and 5 who did not. And that was a part of our recruitment strategy, was to examine those additional kinds of supports that you might be getting from vocational rehabilitation. Next slide. We tested the feasibility of our network measure, and we were able to create a combined network. So let's go ahead to the next slide. These are the participants in our study. As I explained, we had 10 autistic youth, 10 of their parents and caregivers. And then we had, actually there's an XX here because I had to break it up between pre and post. We had 13 in pre and 9 in post who participated in the study. Next slide. All right, so here is the representation of the network of one youth. So you can see on the top part of the slide, we have the youth network, and in the middle, the caregiver network, and then on the other end, the provider network. So on the top part of the slide, you can see each individual network. What's represented in the box is the combined network, what we call the ecocentric network, that takes the people that the youth named as supporters, the people that the caregiver turned to support their youth, and the people the provider turned to support the youth. We took all of those people who were named and we combined them into one ecocentric network, and that's what you see in this box. Now, you can see the circles that are represented as green are people who are named by the youth as transition supporters for them. So you can see all the circles that are green were people that were named by the youth. You can also see that some of these green circles also have a purple circle. What that means in the ecocentric network is that they were named by the youth and also the caregiver. You can also see circles that have a green and a purple and a yellow. And what that means is they were named by the youth, they were named by the caregiver, and they were also named by the provider. So you really get to see how people in the network, some were named only by the youth, some were named only by the provider, some were named only by the caregiver, and some were named by either a pair of those or all 3 of those. So you can begin to see the true representation of the support that's provided around the youth, not just from the youth's perspective, but from the caregiver and the provider perspective. Next slide. We actually compared the youth networks to the ecocentric networks to see if they really did yield a different story. And we were able we did find with this preliminary data that at time 1 and time 2, you can see the youth network, the mean score went from 11.1 to 7.7. So there was a drop in transition supporters for the youth. But if you look at the egocentric network, you can see that the drop was far more considerable than you might only understand just from looking at the youth reported network. So we really see the change in the network from the pre-transition to the post-transition time point here when you're able to look at all the alters from the youth, the caregiver, and the provider. Next slide. We also looked to see how COVID impacted the networks. Next slide. In this slide, you can see Youth 1 and Youth 2. So these are the ecocentric networks from 2 different youth. And all the red circles are people whose interaction decreased during COVID. And yellows, the yellow, let me get back to my key so I can make sure I have it in my head. The yellows are same interaction and the greens are more interaction. So we can really see how not only that COVID impacted the networks and all the networks were impacted by COVID, but also there's very little green, there's very little increase in interaction too. So, and we can see who and where in the network we're seeing decreases in interactivity. Next slide. Here we're looking at one youth in pre-transition and post-transition, and what we were able to see across our youth networks that they, where they might be larger and denser in pre-transition, we saw smaller and sparser in post-transition. So we're able to characterize these connections also. Next slide. We looked to see what roles were represented. We looked at the 299 people that were named by all the youth, their caregivers and their supporters, and you can see a diversity of roles represented. Next slide. We looked to see what resources were embedded in these networks and that the youth were accessing, that the caregivers were accessing, and that the providers were accessing. And you can see there was a diversity of resources represented in these networks. Next slide. That first slide was pre-transition resources, and this is the post-transition resources. Next slide. We are taking our findings and developing a network measure, a network app that can help youth build networks pre and post-transition and strategically create new connections that can sustain and support that bridge from the pre-transition context to the post-transition context. We call this app the Trestle app. It's based on a lot of our work we did here with AIRP. Go ahead, next slide. We're currently recruiting for this study. We're looking for youth ages 13 to 29 on the spectrum who are transitioning to adulthood. Next slide. All right, that's me. I'm trying to make my 8-minute time frame. I appreciate your time today, and I'm happy to answer any questions or comments via email. I'll go ahead and put my contact information in the chat. And thank you very much for this time to present my work. Not just my work, but my team's work on all of this. And I get to hand off to our next presenter, who I think is Anne Rue.
That's right. I don't see myself pop up there yet. We'll give it a second. Okay, and if you could advance to the next slide. So these are, keep going because I think these slides are for a different presentation. If you could, thank you. Okay, so I'm Anne Rue, and I'm excited to talk today about a pilot study we're conducting called the Transition Odyssey of Youth with Autism on the Road to Adulthood. And the purpose of this study is to address gaps in knowledge about the transition odyssey from high school into early adulthood, and we have a special focus on understanding the needs of disadvantaged youth within this project. Next slide. Thank you. So this study is important because there is very little known about the actual process of transition as youth move out of high school, and there are no published instruments currently which specifically focus in depth on measuring transition. And in particular, there's a gap in the literature regarding youth who come from disadvantaged backgrounds and how they might experience transition differently. So this study seeks to address that by developing a systematic, feasible, structured, economical, meaning an efficient approach to gathering data about how transition unfolds over time, what the steps are, the sequencing, and how the events of transition are coordinated for youth and for their families during the transition process. And as I said before, we're thinking especially about disparities in how people access and what the outcomes are for different types of families. Next slide. So we are conducting the study in 2 portions, and this is preliminary data I'll be talking with you about today. So this is not published, and we are still in the process of conducting the study and analyzing this data. But basically, we are conducting this first by talking with parents about their experiences, and then very soon this fall, we will be launching our study of young adults, talking to them about their transition experiences. And when we've been talking with parents, we have 3 main questions that we are seeking to find out about. The first is how they conceptualize or understand what transition means and the transition into adulthood. Then we want to know how they are actually experiencing transition over time. And then we're interested in how people recall information about transition, because these are things that may have happened over several years of unfolding information. Next slide. So we chose to focus our pilot study of parents on parents who had youth in one large major urban school district that is characterized by a high degree of economic disadvantage. And you can see from the characteristics on our slide that we did achieve that, in that we talked to parents who were 80% Black, 40% low income, meaning they were less than 185% of the federal poverty level. About half of them had a 2-year or 4-year college degree or higher. And then among young adults that the parents represented, about 60% had co-occurring intellectual disability. About 90% were using public health insurance when they left high school, and only 10% were seeing specialists for medical care. Next slide. So we conducted a survey first, and we asked parents about young adult outcomes and about their transition experiences. And then we conducted an interview with 8 of those parents. In terms of survey results, we found that 100% of these youth were still living in the parents' home up to 6 years after high school. About 50% were on Medicaid waivers. And this is important, I think, in terms of the next results we'll discuss, because these are people who had some level of access to care coordination and information about transition. About 50% had a service plan with some type of agency at the time that they left high school. And unfortunately, about 70% experienced a period of disconnection from daytime activities. 30% of people said these gaps occurred frequently, and 40% said they never had services to reconnect to activities. 0% of these families received any type of healthcare transition information as their youth proceeded from pediatric care into adult care. Next slide. So consistent with similar studies that we've conducted, we found that service use declined dramatically over time. And in particular, if you look at the middle bar about vocational information, vocational services fell from about 90% use during high school, that they were receiving some type of vocational programming, to 30% after high school, according to what parents told us on a survey. Next slide. So we asked parents about how the transition went and about how they felt like life was turning out for their young adult. 30% of parents felt the transition services were appropriate, which is unfortunately fairly low. 40% felt that they were somewhat or very dissatisfied about how life was turning out for the youth. And when asked about whether parents felt that there was an active plan or a goal for their young adult in terms of continuing to improve their life, only 20% said yes. Next slide. So I'm going to talk to you about several themes that emerged when we talked to parents in depth about their transition experiences. And we analyzed these in terms of a social process. So there are 3 main themes here that we think are interrelated. The first is that parents are obviously not receiving enough information about transition. Many of these parents relied on the school to help them understand transition and to direct their preparation for adulthood. But people told us things like, no one talks about it, no one lets you know what is going to happen. So parents overall felt like they didn't know what to expect. They often felt like it was too far down the road that they were receiving the information that would have been very useful for them to have earlier on. So in some cases, parents reported that it took actually years to get calls back from service agencies to connect with services or find out the answers that they needed. When they did receive information, it was oftentimes from other parents that they met through different services or social activities. And then parents felt that terminology was very much a barrier in understanding transition. So words that we use commonly on national surveys, like asking parents whether they attended a transition planning meeting, could be a barrier for some parents if they're not understanding what a transition planning meeting is or how that might be different from a regular IEP meeting. Other words that are commonly used, like services, could also be a barrier. Some parents, especially as they enter adulthood, tended to talk more about services as programs or more informal supports than actual formal services that they might have associated more with things they received during special education. Next slide. So because parents received so little information, it seemed that parents internalized responsibility for the transition and took it upon themselves. And it seemed to turn into basically a fight type situation where they were having to fight for services, or a fault where they internalized a lot of self-blame for how things were turning out. And emotions tended to be very high in these interviews as people talked about a lot of regrets that they had about if they could go back in time, what they wish they would have known or what they would have done differently. People told us they will fight you, they will lie, they will tell you that we don't do this and we don't have that, when actually when they talked with other families, they found out that some things were available that they just didn't know about. And then a lot of regrets and feelings of disfailure that at least half of these parents, the youth had Medicaid waivers at the time that they were transitioning. So it's interesting, just this degree of disconnection that they still experience despite that. Next slide. So because of this lack of information, we found that these poor transition experiences impacted how parents viewed the youth's skills and abilities over time. So they tended to have limited or low expectations for the future. Some of this could be because they had few positive models of what could be or what services they could be receiving for the youth. When things did go well, parents were surprised. And then positively, we saw that expectations of parents sometimes changed over time when they did see how things worked out for the youth. So they may have been very fearful initially about things like using public transportation or ability to become employed. But then over time, when they saw that youth were able to achieve these things, it did positively affect their impact of what was possible for the youth in the future. Next slide. So COVID obviously has had an impact on how youth have experienced transition. We consider these families to be multiply vulnerable. Low-income, marginalized families face transition challenges that are exacerbated by the disruptions that are experienced during COVID. We do have some preliminary suggestion that families who are connected with formal transition programs may have been bolstered against some of the disruptions from COVID. So that's a positive thing that we're analyzing. We did also note that relationships seem very key for families. They relied upon relationships more for information than more structural aspects of transition, like documents or like transition planning meetings. And then we found that families appeared to use multiple types of what we called cultural wealth. So they used strongly their social networks. They used resistance in fighting for help and in getting online and researching things, trying to figure out what they should be able to access. And then they also demonstrated navigational wealth as they were able to figure out the system over time. Last slide. So I think that this quote is a particularly good summary of what we heard from parents. This mom said, I mean that there is a lot of help out there. There's a lot of resources, but if you don't know how to get them, they might as well not be there, which seems very poignant and leads us to several preliminary recommendations. The first, in regard to how parents recall information over time, it tended to be rather fuzzy recall. It was difficult for parents to recall correctly, like the sequence of events of how transition unfolded. They had a general idea of what happened, but reported that it was difficult for them to remember exactly how things happened over time. And so we suspect that having prospective longitudinal data collection would be highly helpful in trying to understand what happens to families during transition. And then as we think about planning transition instruments, we're going to pay special attention to the language that we use, avoiding words like services, like transition planning, and then linking to administrative records when possible to understand how parent reports line up with what is actually in the records. And then we definitely find that there is a high need for proactive early information and guidance for parents regarding transition-related decisions. Basically, as we talked with parents, we felt that life would have turned out a lot differently for these youth over the past several years had they had earlier access to the information that they needed in order to use services and to have improved outcomes. And that is the end of my presentation. Thank you for your time today.
Thank you, Anne. Next slide. We're eager for the next steps in our work on ATRP. We have plans for future NAIRs, our National Autism Indicators reports, focused on an array of topics that move forward progress toward the goal of healthy and successful transitions. We're working on a NAIR led by Anne Rue that emphasizes Medicaid as a key insurer during and across life transitions, and we have plans for access to and use of emerging data about the impact of COVID, climate change, and the evolution of the Medicaid system in the reverberation since COVID-19 impact as well. Medicaid's a system that's often changing and where this large data is especially well poised to help us implement new strategies for success. Next slide. So please reach out if you have any questions or feedback. We welcome ideas, new collaborations, and we encourage you to check out our National Autism Indicators reports, which Jessica provided a link in the chat as well. And with that, I will close out our presentation. I think we are going to have a brief period for moderated questions, but please jump in if that's not the case. I know we're running behind.
Yeah, thank you, Lindsay. I mean, thank you to all the presenters from Drexel University. I just want to quickly say I really enjoyed learning more about the ATRP projects, and the public health approach is very prominent in the overall research design. Your team uses population level data to address these system level needs that end up improving the overall quality of life for autistic individuals and their families. I particularly enjoyed the use of the mixed methods in the research, and I think we'll start to see qualitative methods used more often to complement population level statistics and health services research. I think we only have time for probably one question. I wanted to pull one out from the audience, and let's focus on the last one. Did you find if there is transitional support through pediatric clinics? That was focused on that transition Odyssey.
So this is Anne Rue, and no, we did not find that. Parents reported that they did not receive any type of health care transition programming. These were parents that were mostly still seeing their pediatrician, but were not engaged to our knowledge with any particular pediatric health clinics. That could be due to the population that we surveyed, and we only spoke with 8 parents within these interviews, so that should definitely be taken into consideration.
Great, thank you, Anne. I just want to also point out that Dr. Lindsay Shea will be in breakout room D for the meet and greet. So if there's any follow-up questions in regard to the ATRP projects, feel free to ask her then. Thank you, everyone.
Thank you so much. This is Dawn Rudolph back as your MC. Thank you so much for that excellent presentation and discussion. There are questions in the chat box from the audience, and if there are additional questions for the panelists, feel free to pop them in the chat box, and maybe that the panelists can answer them in the chat box as well. I did see a question about whether the slides will be available, and yes, they will be made available and archived with the meeting archive.